I saw many times a lot of my patients with these kinds of problems, and sometimes they said, look, I would like very much to stop smoking, but I cannot. So, and we have several therapies in our dental activity, in our dental office activity, that needs to stop smoking, because the vascular dynamics, it's changed when the person is smoking. So sometimes we have to help the patients, and how can we do this if we don't have another tool? You know, usually when something innovative appears because it's a need. It's a need, so we don't find an alternative if we don't need it. So that's why I think the tobacco harm reduction is something that appears just because we need it. Like, let's say, a very basic example, the powder milk for the breastfeeding mother who cannot give milk to her baby.